So finishing out our afternoon session of presenters, I'd like to welcome to the stage Vice President Walt Dix. Walt Dix is going to talk to us about something really important related to cancer presumption and policy priorities. Walt is the IFF 12th District Vice President representing Florida, Georgia, North Carolina, South Carolina, Puerto Rico, and the Caribbean Islands. He holds a degree in public administration from Nova Southeastern University. In his leadership role, he advocates for the needs and interests of the fire service community in his district. Please welcome to the stage Mr. Walt Dix.
Well, good afternoon. It's always nice to be at the end of the afternoon, keep everybody awake and going with such an interesting topic. But we had some great speakers today. We talked a lot about cancer in the fire service. How do we get cancer? We talked about how do we prevent cancer. We talked about nutrition, wellness, mental health, exercise. And so we're going to talk for a few minutes here about cancer presumption and what the policy priorities are of the International Association of Firefighters. So I was a firefighter for 37 years in Broward County, retired as a captain, spent a good part of my career working with the union, building up our union and working on union contracts, and advocated very highly for health and safety measures, and worked to actually put, I was very proud of the fact that we put in our contract a mandatory physical for everybody, which was a monumental thing at the time when we put it in there, and to try to convince all of your men and women that they should get a physical and that they should know whether or not they're healthy was a whole nother monumental task. But we got there. So our objective here is to identify the firefighters' hazardous environment, increase the risk for cancer, and the IFF's recommended reduction efforts. We're going to just briefly describe how PFAS uniquely affects firefighters. You've heard a lot about that already. We'll interpret some of the presumptive legislation that's out there. You'll see that pretty much every state and province does something very different. Understand the value of carcinogenic exposure reporting, which will be a key takeaway at the end, and learn about what is the IFF doing on the legislative front. We're doing quite a bit of good cutting-edge work in legislation. So I pulled a quote from Dr. Dan Wu. He's the Chief Medical Officer for the IFF, something we have only added a couple of years ago. And I think the last line is most important. It's the time to address life and death crisis of cancer in the fire service was yesterday. So I applaud all of you for being here today and listening to all of these great speakers that we have. So just very briefly, how are firefighters exposed? Well, we're exposed to carcinogens at every fire that we go to. We all know that. We've all heard that. There's a wide range of chemicals present that actually contribute to this exposure. PPE and equipment are contaminated until their proper preliminary exposure reduction or decon is performed. And we've talked a little bit about today about the need for decon and the need to have proper decon. Firefighters also face secondary exposures. When they take their gear off, they're exposed to these carcinogens. And there's chemicals brought into the cab, back to the station, and we also know it comes back to our houses. It goes to our vehicles, our families. So there's a wide range of exposures out there. We know the PFAS hazards. We know where they are. They're used in industry. They've been widely used since the 1940s. We also know that there's been a lot of research done on the fact that these PFAS chemicals, these forever chemicals, do cause cancer. The class are highly persistent chemicals that stay in your body, and they stay in the environment for a very long time. Where do we find, as firefighters, where do we find these chemicals? Well, we find them in fires, in the materials that are burning in the fire. We find them in IAFF foam, and we find them in our turnout gear. And you've heard a little bit about each of those. We've even heard about wildland fire today and the WUI situation and how they're affected. So although PFAS is being phased out, we still have a multitude of avenues of exposure for firefighters. And what are the health effects? Well, I think we're learning more and more every day about the health effects of PFAS in the fire service and how they can impact us, how they can impact our family, how they can impact our children. So, are exposure reduction efforts enough? Well, I'll say no, they're not enough. Coming to a conference like this is a great start to move along, and what the University of Miami done is just amazing in what they've done to advance the technology, they've advanced the science, the research, and the knowledge amongst the fire service. Because I can tell you, when I started back in 1978, if you wore a SCBA into a fire, you got called all kinds of names. That was not the thing that you did. It was not a thing that you cleaned your gear. So we're learning from all of this over time. But obviously, SCBA, wearing it from the beginning to the end of the fire, is one of the most important things that you can do. Perform on-scene preliminary exposure reductions, gross decon. These are all things that we already know. And then lastly on there, switch to PFAS-free alternatives for gear and for foam. And that's being done legislatively as well. So here are the numbers, and I hate to contradict one of the physicians that spoke earlier who talked about cardiac issues, but what we're seeing is 94% of our line of duty deaths last year were from cancer, occupational cancer, and these are as reported to the IFF. And I know there's a number of different agencies out there that use different reporting methods, but our firefighters who belong to the IFF report occupational cancer based on what their presumption law says. So if their presumption law has 10 cancers, 20 cancers, 25 cancers, whatever it has in it, and the individual passes from occupational cancer, they report it to us, and it goes on our wall as a line of duty death. 69% of line of duty deaths from cancer throughout the United States, and 92% in Canada. And I think what you'll see in Canada is they have a much more robust presumptive law than we have in many of the states of the United States. So to combat cancer rates, IFF PFAS efforts, what we've done is we've worked with the IFC, Metro Chiefs, and we developed a safety advisory. It's on that link there. You can go to the IFF.org website. You can go to our PFAS page, and you can see our advisory there on the adverse health risks from your turnout gear and what the fire chiefs and the firefighters are recommending that you adopt as policies to help combat the exposure to PFAS and to carcinogens. The other thing that the IFF has done is we put together 2 small-scale framework studies. One of them included the city of Miami here. We took 5 fire departments. We purchased PFAS-free turnout gear, and we asked them to evaluate them for fit, comfort, wearability, and we're still in the process of collecting all that data. And the idea is to be able to compare what we were using today that had PFAS in it to what's being developed tomorrow that's PFAS free, so that we can come out with recommendations to our members on what the best approach is. We did a pilot PFAS blood test where we also completed a small-scale framework study to support, recruit, and enroll members that were effectively educated on how to measure, interpret, and test their own results. We used the Eurofin testing methodology, and we're still evaluating all of that, and we'll provide that information once we've completed those studies. But we're heavily involved in trying to find out what the best of the best is for our members. Firefighters ask us all the time, what kind of gear should I buy? What brand should I buy? What this, that, the other thing. And so we're trying to do the research to be able to provide that information to our members so that they can go to their employers and make better informed choices when replacing their turnout gear. So we received a grant to study PFAS-free gear. We established an advisory panel to meet with IAFF members. We created a focus group. We conferred with industry experts to develop a current hazard analysis of our gear. Some of the thought process that has gone through the IAFF, through a lot of our members, is we may be over-engineering our turnout gear for what we're doing today and getting ourselves into situations that we probably shouldn't be in because we don't realize what's going on in the thermal environment. And we've gotten ourselves into such a bad situation because of this over-engineering of gear. So we're beginning to research that and have come to notice that the gear you might want to use in, let's say, a northern state of Michigan, where the weather's quite different than South Florida, can be very different. Those thermal ratings can be different, and you will want to try to develop turnout gear that matches the environment that your firefighters are working in. So that's a kind of project that we're working on. This is a path forward to PPE that will protect firefighters based on their demand and their risk in their community. We participated with the NFPA revisions of the latest 1970 standard, and we've employed 3 PFAS law firms, 3 of the most prestigious law firms in the country. One of those law firms worked on opioid epidemic, one worked on tobacco, and the other law firm worked on the 9/11 issues in New York City with the wellness of those firefighters. And they support our members who are diagnosed with occupational cancers. So to combat the cancer rates, these are what the IFF, went the wrong way, sorry. This is what our general president says all the time. We need to do whatever it takes to end the scourge of cancer in the fire service. And I got to tell you, we have one of the most progressive general presidents that the IFF has seen in a long time, who has made eliminating cancer from the fire service our #1 priority, to the tune of investing in our health, safety, and occupational medicine department, putting on Dr. Dan Wu, who's now our chief medical officer. First time we've had a doctor full-time at the IFF, and supporting the research. And our members have supported us in putting money into this research. We passed a number of resolutions at our last convention to be able to fund cancer research through grants through the IFF. So let's talk a little bit about presumptive legislation. What is cancer presumption? Well, presumption identifies that any cancer included in the legislation is job-related. As I stated earlier, that can be very different depending on what state you're in. One state may have 20, 15, one may be unlimited. We have some states and providences that cover the gambit of cancer and consider them to be all occupational. And so these presumptions need to be researched by you in your jurisdiction so you're familiar with them. Are they all the same? No, they're very unique, they're very different, and the best way for you to support it is through exposure reporting, which we'll talk a little bit more about, and the available science, and to help fund the research. And that's some of the things that the IFF has been heavily involved in at the federal level. I know our state association in this state has worked very hard on a state level to provide funding for grants to assist in research, and that's how we get these programs moving forward. So this is what the map looks like, and these are the three categories that we break down presumption between the United States and Canada. You can see the majority of the map is blue, and that's where we have what we consider a presumption that exists. Then we have what we call benefit eligibility, which is if you contract an occupational cancer as defined by their statute, you may be eligible. I use the word may because a lot of the states that we deal with that are in that gold color tend to reject our claims of occupational cancer. And we tend up having to have a lengthy legal battle with them over it to try to get those benefits for those firefighters. And then we have one state, Kentucky, that only provides a death benefit. And so they have a presumption for only death benefit, nothing while you're living or going through cancer treatment. And these are things that we continue to work on. But I think you can see we've made a tremendous amount of progress when you see all of the blue on the map. So, exposure reporting. Exposure reporting is documenting each exposure, that's important, establishing a reporting policy or a tool so that you can accurately report your exposure, use an exposure tracker. And I put in red there the takeaway, and that is good documentation can be the difference in getting benefits for your occupationally acquired disease or not. And I'm just going to say that one more time, good documentation. So whatever method you use for documenting exposures, please continue to do that and emphasize that. And I'll just quickly highlight our legislative priorities that the IFF is working on a federal level. We're support the Honoring Our Fallen Heroes Act, which would add occupational cancer. It would recognize 20+ cancers as job-related to the public safety officer death benefit. We have full-time staff that assists our locals in applying for the public safety officer death benefit. We're supporting Medicare multi-cancer early detection screening. This will help most of our retirees because currently Medicare does not cover FDA-approved screening tests, and so we're trying to get that placed into that legislation so that if a retired firefighter, will be able to go out and get some, proper coverage and testing. Our Federal Firefighter Cancer Detection Act, which would provide breast, colon, and prostate cancer screenings for Department of Defense firefighters because we have to work on all of their projects through federal. And we're supporting the PFAS Alternatives Act, which would create research and development grants for PFAS-free turnout gear. And we work with all of our state affiliates to improve and pass their own legislation on presumption. And so we just need to take away from this that we need to help ourselves. We're out there helping everybody else, and this is the way we can help ourselves. Questions?
Excuse me.
Yes.
How is the IAFF working on ensuring that the department policies are updated to ensure that we protect the firefighters? A lot of times policies are so outdated, and which I've read, that what's going on now does not reflect within the policies to make sure that the firefighters know what to do and how to do things, so they're always under protection.
Well, we're trying to provide best practices. Our staff is continually available. I know that we get a lot of calls for people to review policies and make recommendations on them. We're wide open to do that anytime. As far as going out there, that's extremely difficult, as you might well imagine. I think through the accreditation process, that's something that we've been heavily involved in. The CFAI accreditation process is one area that I think we could focus on your point and make sure that they have an adequate policy.
Walt?
Yep.
Julius Hallis here.
Yeah.
So obviously there's really good coverage, and from time to time with the science and the different teams that are working on progressive best practices, from time to time you could think about opening a statute to add some additional benefit or additional type of cancer that may be studied. Like in Florida, there's 21, but like leukemia and some others are not in there. So from the International Association of Firefighters legislative perspective, how do you evaluate when's a good time to take that risk of opening a statute, lest you possibly lose something, or the vital need to add something? Your thoughts?
Well, I would say number one is you got to have the research. So you got to have the backing for that. And we ran into that a couple of places, a couple of states where they said, well, you don't have enough research on, for example, female cancers within the fire service because we have a very small population of women in the fire service, and we don't have a robust amount of research to back up the fact that they're getting high rates of breast cancer. So those are areas that I think are very important where, such as the University of Miami helps us to develop that research to make those arguments. Secondly, you've got to rely on your state associations. We have a state association in every one of our 50 states and throughout all of our provinces in Canada, and they know when the time is right. And that would be my recommendation, to go through them, because all of this becomes very political. But I do want to send out a real kudos to, well, I'll call her Chief Kobitz now, thanks to that new title. But we wouldn't have cancer presumption in Florida if it wasn't for her testimony. I mean, I recall vividly when we went before the Florida legislature and they were quizzing her about firefighters, cancer, this, that, and she just bluntly said, we already know firefighters are getting occupational cancer from all of these things. What we're trying to do is figure out how to prevent it. And so that kind of sealed the door on that. We were able to get that done. But to your point on leukemia, there is a movement right now to bring that into the Florida statute. But I think each case by case, state by state, providence by providence, you've got to go out there and see what the politics is like.
Hey, Walt, just to clarify on that, a bill was filed in Florida. A bill was filed in Florida already to expand the 21 cancers.
Yes, that's correct. It's going through the committee process now, so we'll see how it goes with the legislature starting up in 2 weeks. Yes.
Hi, I just wanted to say thank you for talking about policy. I'm an occupational medicine physician, so we work with you guys closely on cases that prove causation. We work with you guys on causation cases. We provide that documentation that you emphasize is so important to get your death benefits or what you're seeking out of your claim. So go to an OCMED doc, occupational medicine doctor, if you have a need related to a case of cancer or another occupational disease. I'm targeting that message to all the firefighters. I also wanted to ask you if you guys at your organization disseminate information about what providers, what physicians to go to that can provide good documentation. And the second ask I wanted is perhaps to form a partnership with the Occupational Medicine College, because our residency is in danger of losing funding due to NIOSH, the National Institute for Occupational Research, losing funding potentially under the new administration. And so I think it'd be really helpful if, you know, firefighters recognize that we do want to help you guys with your injury-related claims and your documentation to get the benefits you deserve. But we also need to create more occupational medicine doctors. So I really appreciate you giving us a shout out and highlighting the importance of voting people in that are sympathetic to your cause as firefighters facing this elevated risk of cancer.
Thank you for that question. And I don't speak on behalf of the entire IFF, but I could tell you on behalf of my district and the brothers that sit on the executive board, I think we would more than welcome a partnership with Occupational Medicine School to advance that. I'll give a shout out to my colleagues who are here. Neil is here, Raquel is here, Dr. Dan Wu is here, and they really make up the heart of our health, safety, and medicine department. And so to your point about having you know, SMEs, we provide that assistance, and that's something that we've kind of beefed up this last convention. We put money behind it, and so we do provide that expert, medical opinion. If somebody needs that, we'll do whatever we can. The only problem we have is we're being overwhelmed with the number of requests. So it takes us about a year currently is our kind of wait time for somebody to come to us and say, hey, I need an expert to help me. But we're helping firefighters all the time get their benefits, whether it's through disability, through their pension, through their workers' compensation, and we'd be happy to work with you on that. Anybody else? Thank you very much for your time today. Appreciate your patience.